The second part of this brief three-part series on a practical guide to your DM casebook will focus on producing an outline of your entire case report and then discuss a little bit about how you present the case itself. So again, these are the objectives for the entire three-part series, and as I said, we're going to focus on writing a case outline and presenting the case. What is an essay outline? It's something you probably haven't done for a long time, maybe going back to SEA, but what we really want is a paragraph by paragraph outline of the entire case report from introduction to conclusion. It should be in point form, and it should be divided into the sections that your case report will be divided into, which is introduction, case report, discussion, and conclusion. And each section may be divided into subsections. As we talk about the sections during this three-part series, I will elaborate on the kinds of subsections you're looking at. In your outline itself, you should actually make a little note about what tables, figures, or illustrations you're going to use and where they might fit in to the entire case report. In this way, before you even start writing, you know what you're going to write and you know where each bit of your writing is going to fit in. It takes a little bit of time. It's well worth doing. You're spending a week getting this right. Will save you weeks of corrections after you submit your case, because it also allows your case report to have a structure that your reader will understand. So I would say it is essential to produce an outline before you start writing. So let's look at this in a little bit more detail. Let's think about what your outline would look like. It will have an introduction, and the two things that you want to answer here: what is the case and what is the focus of your discussion? They may be actually in two different paragraphs, or they may be part of the same paragraph, but you need to, when you're writing your own outline, actually have a point saying a case of pulmonary embolism in an older patient. And point two, my focus will be the use of thrombolysis versus embolectomy in this age group, or something like that. Then we go on to the case report itself. There are 4 parts to the case report. You're going to present, you're going to talk about how the patient presented, how they were initially assessed and resuscitated, the progress through their care in emergency medicine, and then their final disposition, including a very brief summary of what happened after they left you. Did they stay for 3 weeks on the ward and then go home? Did they die while they were an inpatient? Were they discharged back into the community for follow-up care? Again, for each of these, you're going to have 1 point. The patient presented in this manner. Our initial assessment included, IV fluids, oxygen, whatever. During his progress, his blood pressure dropped twice, and then he was adequately resuscitated using a combination of fluids and IV drops, something like that. And finally, the patient was admitted to the ICU. He spent 2 weeks there, stepped down to the ward, and was finally discharged 6 weeks after admission to hospital, something like that. And those are your 4 points. Then we move on to the discussion. There are 4 sections again. An initial overview of the case. Pulmonary embolism in the elderly is common and difficult to initially diagnose and presents challenges in management decisions. So that's your first point. The second point is the introduction to the topic of focus. This discussion will focus on the choice of definitive care for these patients, bearing in mind that they have a high mortality but may not be able to tolerate aggressive interventions as easily as a younger person. Then something on your detailed discussion, just a little point saying this is where my discussion is going to go, and a final point about how you're going to wrap up your discussion in terms of local relevance or your own opinion. And finally, your conclusion. Bearing in mind your conclusion is usually one paragraph in which you're going to summarize the main points and give implications to your local practice. But in your case outline, you're actually going to decide what your summary is going to look like. The summary is going to focus on the options available for treatment of pulmonary embolism in the elderly. And it's going to talk very briefly or just remind us about what we thought about local practice. Remember, no new information in the conclusion. All right, so let's go on to that middle bit, the second bit of your case report, which is actually the report of the case. And we're going to look at those 4 subsections. So the first subsection is the presentation. This is usually just one paragraph saying how the patient presented. You know, they came in, brought in by relatives with a history of 3 days of increasing shortness of breath and chest pain, or they were brought in by the ambulance service after having collapsed at home with severe chest pain and shortness of breath, or something like that. And it's just an initial paragraph to tell you, introduce you, your reader, to the patient. Then an initial assessment, which goes through what you did, what investigations you did, what the patient looked like on initial assessment, and what you did to resuscitate them. This section usually includes some tables and figures from the patient, you know, images of scans or x-rays, blood results, that sort of thing. Please remember, this must come from your patient. Do not be tempted to go online, find a picture of something that looks a little bit like what your patient might have had. Your examiners have access to the internet, and we have had situations where the examiners have found this dishonesty and the casebook was failed. So tables, lab results, figures come from your patient. Then we're going to go into a little bit more detailed discussion about the ongoing care of the patient. So you did resuscitate them initially, then what happened? Did their blood pressure drop? Did their oxygen saturations not improve? What did you do? Did that work? Did you put them on CPAP? Did they need intubation? How did that work out? And again, more relevant results and images and tables. Sometimes those tables and results might be combined with the ones that you use in the initial assessment. So for example, you might have one summary table of all your blood results in chronological order. Or you might have one figure which was 2 x-rays before intubation, after intubation. So they're not hard and fast rules, but present your figures and tables in a way that would be engaging to the reader and would help them understand what happened to your patient. And then finally, the disposition, usually just one paragraph which outlines what happened to your patient, a brief summary. You know, if they went to the ward, just a few words on how long they stayed, did they improve gradually, did they have a rocky course? If they went home, what follow-up plans were made? Do you know what happened? What happened when they came back to clinic in 6 weeks' time? This rounds off your case. It's not the most important part of your case. Throughout this entire process of writing your case report, remember that you are presenting objective, factual data about what happened to your patient. We don't want to hear what you think should or should not have happened at this stage. This is just objective, factual data about what happened to your patient. Try not to include every single thing, you know, who said what, and you know, they were seen by pediatrics, but then they found out it wasn't a pediatric patient, so somebody else came. If this is not relevant to the case you are presenting, leave it out. Keep your case report concise and focused on what you are trying to show the reader. So that was a quick review of writing a case outline, essay outline before you start your actual writing, and what your case report looks like. I cannot stress too much that you need to write a case outline. If you have any questions, again, we can talk about this in the class on Wednesday, or you can post it on your WhatsApp group or send me an email. In summary, we have been discussing how to choose a appropriate case. How to write a case outline for your chosen case, and then produce your case report, the second section of your case, in an objective, factual way. The last lecture is going to talk about your discussion, conclusion, and references.